Okay, go ahead.
That's the outside.
She taking pictures.
No, that's he got it.
Are we on? All right. So, one of the complications of this chemotherapy that everybody gets is it's hard on your GI tract. So it kills and does damage through your gut. Some people, pretty commonly, about 1 out of 10 people that we do this for will have this complication where there's enough damage to your gut, the way it reacts is it just kind of freezes, it kind of stops up. So nothing moves through the stomach, nothing moves through the lower GI tract. So what we normally do in a situation like that is if your stomach nothing's moving through your stomach, it fills up with juices and you start throwing up, and it's pretty miserable. And so we put that tube down. Believe it or not, as uncomfortable as it is, it actually is better than all the throwing up. So that just removes all that to kind of help decompress the stomach. And then we wait. It takes some time to get better. So, when this all started, it was kind of a classic case of what we call this syndrome, and what we call ileus. It just means the frozen up gut after some kind of injury to the gut. And it can happen not just after chemo, people after surgery. If you have surgery to your belly or something like that, people very often will have some ileus. So, and so for him, it kind of came on around the time that it usually does, which is right around when your counts start to come back up after that transplant. That's when all of a sudden, before that, he was just having, the usual nausea and diarrhea. But when those counts come up, sometimes it really increases the inflammation. So the counts have come up, and the transplant has done what it's supposed to do in that sense. But he's continuing to have this inflammation. And it's gone on longer than I like, I'm sure, and longer than you like. About the best thing I can say is it hasn't gotten any worse. Sometimes there can be serious complications. If the damage to the gut becomes so great, you can even get a little hole in the gut, what we call a perforation. And that's an emergency, because if there's a perforation, then what's in the gut can spill out into the rest of your belly. Mm-hmm. So far there's no sign of that, and we that's what we worry about the most and what we watch for the most, and we check them every day. We actually repeated another CT scan a couple of days ago that showed that things were basically the same. We asked the GI doctors to come by, and so they came by yesterday, and our question was, is there something else we could be doing? Would it be helpful to do some kind of scope? Look at the GI tract and get maybe a little biopsy or something. They thought that they couldn't come up with any good reason why this would be lasting longer than we expected. We also called the surgeons yesterday and said, is there any reason why we should be thinking about surgery? Usually surgery is something we do just if there's a perforation. And I didn't expect they would say yes, we don't want to do any surgery on him, for fear of making things worse. But they said no, not at this time, but we're going to keep following along with you very closely. And so we're going to keep following too and making recommendations. This has lasted longer. Usually it lasts about a week to 10 days. We're about day 15 of this NG tube. But I was talking to some of the older doctors, and they say that they've seen cases last this long. They say that sometimes adding steroids can help, and so we're going to start giving them some steroids today to see if that can cool off some of the inflammation. But their recommendation to me was just keep sitting tight, keep doing what we're doing. The hardest. It's so hard to see him like this because it looks something about that tube in the nose. No human. That just feels unnatural. And your first impulse, if you wake up, is to try to get it out of there. Mm-hmm. And so we have somebody in the room who's trying to redirect them and keep them from doing that. So I wish I had something smart to say or some really easy answer to this.
So when you want to start the story?
Today.
Okay, today.
Yeah, we'll start today. Right. And we'll start them today, and we'll just sit pat. We'll keep watching them carefully. Make sure this doesn't turn into anything worse, where we need to like a perforation that would be, emergent surgery. Would be the treatment for a perforation is emergent surgery, where they actually have to cut out part of the bowel. And so that's a last resort. We don't want to do that. It would be a big setback for him, but But if we have to, we have to save his life. But right now, the surgeons don't think that's necessary. And I didn't think they would. The rest of his organs look fine. His liver's fine. His kidneys are fine. His bone marrow's fine. His blood counts are normal. We have him on all of the antibiotics and antifungals that we usually have people on. And so we're just going to try to see if these steroids help at all. And otherwise, we're just going to keep doing everything we know how to take care of him. But there's no big changes that we can think to make right now.
Any questions? So how long you expect to be on steroids?
I think if we do it for about 4 or 5 days and it's not any better, I wouldn't continue it. Any sort of improvement we should see in a few days.
Today was the first day I heard him say he was hungry.
It's a good sign.
Mm.
Yeah, it's a good sign. Yeah, a couple of days the way we follow how much this is getting better is two things. If the problem is the gut is frozen, and so when things start moving, passing through below, or if you start hearing sounds from the gut, then that's a really good sign. His gut will will not be quite so. It's very distended right now, and it's painful. When I try to press it, he swats me away. So I don't press it very hard. That'll get better. So that'll be a sign that it's getting better when that becomes a little bit less tender, a little bit less distended. Bowel sounds, and then finally the amount of liquid that comes out of that NG tube, when that goes all the way down, that suggests things are starting to move through the stomach again. So that's kind of what we follow every day, and every day it's not been. Often when people get this, it's like a liter of stuff out every day. He's never had that much. Every day it's about 200 cc's or so, 1 to 200 cc's, and every day I keep thinking, oh, today's the day we'll turn off the suction and just see what happens in terms of the stomach. But his belly just looks still so uncomfortable. I think that it's premature to try to turn off the NG just yet. So it's just day by day.
Thank you.
Yeah. I wish
Thank you.
Oh, he'll get there. We'll get him there.
Thank you.
Okay.